donation is a process where a fertile woman undergoes IVF for the purpose of donating those eggs to a patient or a couple who desires a family and for whatever reason cannot use her own eggs.
So the donor process has no long-term medical consequences. It doesn't affect somebody's fertility. It doesn't increase the person's risk of going through menopause earlier. It doesn't diminish their egg number. There's really no long-term consequences to the donor process. Ultimately, for the egg donation process, they're getting vaginal ultrasounds. They're going to get blood draws. And so the risk with those are very minimal. The IVF procedure where we actually have to take the eggs out of the ovary we put a needle into the ovary. There's small risk associated with that. Anytime we put a needle somewhere, there's a risk of bleeding, there's a risk of infection. But the risk is very minimal. We do treat the patients with antibiotics. Everything is done in a sterile environment. So we don't really see many complications at all. It is a selfless act to become an egg donor and help someone else have a family. However, the egg donors are compensated. They're compensated for their time. They're compensated for the procedures that they undergo. It's kind of like a job that they do. They come in, they get ultrasounds, they're getting blood work, they're taking injectable medications at night. There's subcutaneous injections like an insulin type shot that a diabetic would take. So there's minimal type of procedures that the donor's undergoing. They're undergoing an egg retrieval, so they're getting compensated for all of that. They're not really selling eggs or anything. They're just getting compensated for their time and what they're undergoing. We normally will see the donor 3 to 4 times prior to doing the egg retrieval. Each of those times that we're seeing the egg donor, what we're doing is we're doing an ultrasound and blood work and giving them instructions on what to do with their medication. So they're usually here in the office for about an hour or so. The egg donation process, when we take the eggs out of the ovary, they're here for about 2 to 3 hours that day. That's also a day that they get some anesthesia because that's the time that would be a little uncomfortable if we didn't give them anesthesia. And so because of the anesthesia, they can't work that day, they can't drive that day. So that's the one day that's really kind of does change what they can do work-wise or socially. And then after the egg process, after we've taken the eggs out, we do see them back one more time just to make sure everything is looking normal for them, answering questions. And again, that's a fairly short visit, less than an hour.
Recipients of the eggs do see the profile, of course, that the donor set up. Those profiles do include pictures, as well as information about ethnicity, medical background, what kind of person the donor is. So the recipients do find out a lot of information about the donors, but not any identifying factors, so no names or anything like that.
Ultimately, the egg donors will complete a consent form. The recipients complete a consent form. Basically, this is an egg donation process. There's no legal responsibility for the egg donor for any offspring that come about. That doesn't necessarily mean that they're always going to be completely anonymous because of the genetic tests and everything that are available today, but there's no legal responsibility, and the recipients assume all of that by signing the consent form and agreeing to accept the donated eggs, and the egg donor assumes that as well by signing the consent form.